Dr. Vijay orthopedic surgeon. Today we'll discuss about the osteoporosis. Osteoporosis is the meaning the weakness in the bones and bone structure. The weakness in the bone means there is a deficiency of the vitamin D and calcium leads to fragile bone which possibility of degeneration and fractures in trivial injuries. So these are the most important where the younger people are suffering from the bony pain and as well as the early degeneration and certain times major fractures. So obviously these are the clinical conditions where we see the vitamin D supposed to be more than 30, but nowadays the young people are presenting with 7 to 10 percentage of vitamin D, which is most very quite less for their maintenance of the structure. And vitamin D also deficiency also lead to such problems like skin problems, hair loss problems, bony weakness, bony fractures. So apart from that, the calcium content in the body or in the bones are deficit below 9, then it leads to the same like bony pains, bony fractures and bony weakness which degeneration takes place. So obviously every year once you must get checked your vitamin D and calcium levels. Apart from that, the minerals like magnesium, potassium, chloride and then sodium. These are the most important minerals which sustains the water quantity in the intracellular area of the bone. So obviously when all this vitamin D, calcium, minerals are deficit in the body leads to osteoporosis. So usually the osteoporosis disease termed to be above 45 age women and men. Obviously if it initiates from 45 age, then the early degeneration takes place at the age of 55 instead of 70, 80. So obviously the early detection of the vitamin D, calcium is most important so that we can manage with our nutrition. So certain times when the sufficient balanced nutrition is not taken by a person, who will suffer from the basic deficiency of vitamin D, calcium and minerals. So obviously we should supplement the certain minerals, calcium and vitamin D. So how do you detect the bone density? So the bone density is revealed by vitamin D and calcium analysis, mineral analysis and then bone marrow densitometry, where which the equipment you can place the foot so that you can determine the bone whether it's osteopenic means the osteoporosis, that is the lesser mineralization of the bone or the density. So obviously when it is osteopenic, you need to treat the patient. So when the vitamin D is below 30, when calcium is below 9, then the bone densitometry also is osteopenic, then according to that we should supplement the vitamin. Before that, we must explain the patient how the vitamin D is generated into the body. The vitamin D always produced the sun rays falling on the skin, which produces the cholecalciferol, ergo cholecalciferol, which converted into vitamin D. So we always suggest the persons who are suffering with the osteoporosis, vitamin D deficiency, to sit in the sun, where early morning at 7 to 8 o'clock or before, where the heat will not be there, and then the sun exposure to the large area of skin with a lesser clothes on the body, so that the sun exposure to the skin leads to more production of vitamin. And then eat green vegetables, green salads, fruits, tomatoes, and good balanced diet of fat and protein and carbohydrate. Along with that, sufficient green vegetables, juices, and sufficient water content every day, so that it maintains the minerals as well as your nutrition, so that you will not suffer from the osteoporosis.